Good day everyone, my name is Micaela B. Valencia. I am from section N22 and today I am going to report about postpartum assessment on bladder. Bladder assessment is a crucial function of the postpartum nurse. Though information about the bladder assessment is meager, meaning gamay lang ang information, yet it is one of the most critical of the mother's few hours following her delivery of the baby and for us nurses to determine and promote normal bladder function. So in postpartum, why do we need to assess the mother's bladder? To promote the mother's optimal bladder function after delivering her baby. Now I'm going to proceed with the assessment. But first, always remember to wash your hands before starting any assessment to prevent any cross-contamination. So first thing, the assessment. Ask the mother if she had gotten up to urinate or when was the last time she emptied her bladder. So as you can see on the image, the bladder is directly on top of the uterus. It can be uncomfortable to find her uterus if the bladder is full. Next, inspect and palpate the bladder simultaneously while checking the height of the fundus. As you can see on the image, approximately by 1 hour post-delivery, the fundus is firm and at the level of the umbilicus. When you look at the image on the right naman, the fundus continues to descend into the pelvis at the rate of approximately 1 cm or finger breadth per day and should be non-palpable by 14 days postpartum. Because as you can see, where the fundal height is during the delivery and where it is in the 9th day after the delivery. It is imperative that the first 3 postpartum voiding be measured and should be at least 150 cc. Frequent voiding with or without pain and burning may indicate infection or retention. So for the first couple of voids are measured in a hat. Dili sombrero na hat, but a hat like this. It is called a urinal hat. So mura man siyag hat pod. It is put underneath the toilet seat. It is used to measure the mother's urinal specimen. And dili lang pod siya pang measure lang. Dili lang pod kaayon na dapat tanawan nimo i-measure nimo ang specimen sa urine sa mother. Also, you should always check for the color of the urine, whether if na siya strong amber color, if concentrated ba ang urine, or has a strong smell, because ang mama, ang ilang perineum ana is numb pa, or naa sila trauma sa anesthesia. So some mothers cannot feel any pain sa ilang perineum because of the trauma sa anesthesia or sa prolonged birth or labor. So mana siya important to check for the color of the urine, for it may indicate an infection or retention. Next is to talk to the mother about proper perineal care to help the mother to feel better, heal faster, and prevent any infections. So in the image I have here is an example of a peribato. So as you can see on the instructions, it is used to help the mothers clean their area thoroughly. So dili man pod necessary pod, pero if dili kaya sa mama na makuot niya yung area niya, you can use a peribato. So after washing the area thoroughly, explain that she should wipe from front to back after voiding and defecating. So anong front and back man? Because atong girl's organ is very prone to any urinary infections, labi na UTI. So if you're going to wipe from back to front, you're bringing bacteria sa imong vaginal nimo nga opening. So we are prone to infections. Next is an order from the physician is necessary and catheterization may be done. An order for culture and sensitivity test since definitive treatment may be required. So dili gud siya necessary mag-catheter. If kaya sa mama mag-urinate in her own, then she can. So when man ka makaingon na i-order sa physician na magamit og catheter, if ang mama have prolonged labor, which is makakause siya og overdistension sa bladder. So unsa man pud ang overdistension? Overdistension, in other words, refers to urinary retention. As I have an image here. This is a normal flow of a bladder, and the image on the right is a restrictive flow of the bladder. So sa right, na siya yung overdistension. Overdistension means incapacity to void normally because nawala na ang tone sa muscle sa bladder. And since dili na siya maka-feel og since na siya loss of muscle tone, dili na siya maka-detect og pressure by the urine. So may unsa man pud na ang culture and sensitivity. So on my screen, I have here the example of culture and sensitivity test. When you say culture, it is a test to find germs that cause the infection. So when you look at the image on the left, tama ka ng culture plate, diba? So mara siya og petri dish at a-test siya na makita if unsay bacteria present dito. When you say anong pod a sensitivity test, this is to check what is the best medicine to treat the infection. Dili nang kay bali ang common na bacteria sa bladder is E. coli, which is found on the GI tract. Dili lang kay maingon ka nga na ay bacteria nga E. coli sa imong lawas, tapos magpataka-taka na din ka og hatag og ini antibiotic or ang physician maghatag. Dili kay basin dili lang punpod kay E. coli lang ang bacteria sa ma-present sa bladder, pero daghan pa man which I cannot properly say. So E. coli na lang ako example. So mo ana, it is important to check the culture and sensitivity check para dili lang ka magpataka-taka og hatag og tambal para ana. What if dili siya kana nga infection is dili siya what if magpataka-taka ka og hatag og clozacillin na dili man day siya panglaban ana nga bacteria. So dili jud. Next, bladder distension should not be present after recent emptying. If so, the case that the mother is muscle damage due to prolonged or delivering the baby. When bladder distension does occur, a pouch over the bladder area is observed, felt upon palpation, and mother usually feels. So when you say bladder distension, it means full bladder. A full bladder is one of the causes for postpartum hemorrhage. Postpartum hemorrhage meaning a heavy bleeding after giving birth. But this condition is rare. Lastly, you are going to document as these are the findings we need to chart. So, ano importante man mag-chart? As charting provides record of everything regarding to the patient's care. So that's all for my reporting. Thank you so much, and I hope you understand my reporting.